In this Medicoapps Masterclass, let's look at the basic differences between a Hodgkin lymphoma and a non-Hodgkin lymphoma. Even before we start looking at the difference between Hodgkin lymphoma and non-Hodgkin lymphoma, we should be very clear what is a leukemia and what is a lymphoma. We know that both are WBC cancers, white blood cell cancers, but leukemia is a white blood cancer that develops in the bone marrow or blood, whereas lymphomas are proliferation of white blood cells which are present as discrete mass. So that is the major difference between leukemia and lymphoma. This is what you have to remember. When we talk about lymphoma, it can be Hodgkin's lymphoma and non-Hodgkin's lymphoma. Now, there are some very basic differences between Hodgkin and non-Hodgkin. Let's look at them one by one. So first, remember that Hodgkin lymphoma only involves lymph node. So you don't have any extra nodal sites, whereas non-Hodgkin's lymphoma will involve both nodes as well as liver and spleen. Even extra nodal sites involvement is seen in non-Hodgkin's lymphoma. Second is pertaining to the what kind of nodes which are involved, what kind of lymph nodes which are involved. So in Hodgkin's lymphoma, you will have cervical and mediastinum lymph node primarily being involved, whereas non-Hodgkin's it will be mesenteric lymph node or oropharyngeal or even Waldeyer's ring. So these are a specific distribution of lymph node which are involved when it comes to Hodgkin as well as non-Hodgkin lymphoma. The next important difference is the spread of the disease or the spread of the lymphoma. So when we talk about Hodgkin's lymphoma, primarily it will spread with lymphatic spread. So there will not be any hematogenous spread in Hodgkin's lymphoma. But when we talk about non-Hodgkin's, the spread will be both lymphatic and hematogenous. Now this is a very important, clinical manifestation that Hodgkin's lymphoma will show a contiguous spread, which means, you know, if these are a set of lymph node, from here it will go to this, then to this. Whereas non-Hodgkin's, it will be non-contiguous, spread, which means from here, if this lymph node is infected, directly this lymph node can be, affected. So Hodgkin's lymphoma will show contiguous spread, whereas non-Hodgkin's lymphoma will show non-contiguous spread. So obviously, Hodgkin's will have a better prognosis, but it is less common. Almost only 15% of the total lymphomas will be Hodgkin's lymphoma, whereas non-Hodgkin's has poorer prognosis, but it is more common. Almost 85% of your lymphomas will be non-Hodgkin's lymphoma. Hodgkin's lymphoma is primarily B cell, whereas non-Hodgkin's will be both B and T cell, and there is a classical cell that is called as Reed-Sternberg cell that is seen only in Hodgkin's lymphoma and not in non-Hodgkin's lymphoma. So this is an overview of Hodgkin's as well as non-Hodgkin's lymphoma. Let's look at in the next session about Hodgkin's lymphoma and non-Hodgkin's lymphoma separately.